most common complaints we see in practice is back pain and back and leg pain, pain or pins and needles or numbness going down into the leg. And often this can be a sign of a serious disc issue in the lower back, where the disc is swollen or even bulging or prolapsed, commonly known as a slip disc, and there's direct pressure, inflammation, swelling affecting the nerve from the lower back down into the leg. But not everyone gets leg pain. Sometimes the back pain just comes and goes, where it's grumbling a bit, or you get no back pain and sudden acute episodes. But one of the most common questions we receive or we get asked is it the disc that's involved? We have to say really 90%, I would say, of back pain and even neck pain, there is disc involvement. It doesn't mean it's a severe slipped or bulging prolapsed disc, but the disc is an essential, vital and joining component to the spine. So our spine is made up of vertebrae, the bones. Sandwiched in between the vertebrae is the disc. So the disc is involved in supporting the spine, allowing for movement, and acts like a shock absorber when the pressure and the stress of life comes through. Now the disc spacing provides a space for the nerve. So there's the vital nerve that comes off the spinal cord. And this is where the message comes out to the body. So your brain is communicating down your spinal cord through your spine, and the message comes out of the nerve, and whichever level that is, that goes wherever it needs to go in the body. So in your lower back, the nerves tend to go to your lower bowel, bladder, reproductive organs, and then down into your legs, which is by hips, knees, ankles, feet. That's why any problems in those areas can often be related to the back. Now, most disc problems or back problems are caused by a lack of proper movement in the joints, and they can be caused by improper alignment of the bone. So if the bony vertebrae is not moving correctly, the disc doesn't get health. The health in the disc is provided through movement of the bones. That pumps nutrients in and takes waste products away. So if there's a lack of movement, and especially if there's a lack of alignment, the disc literally sits there, starves, and starts to degenerate over time. But what happens is you get swelling in the disc, and then that swelling can then affect the nerve. And then if the swelling is enough, or if there's pressure enough into the leg, the pain can come down into the leg. So discs are involved in the health and the function of the spine. So any problems with the back inevitably will involve the disc to some degree. It just depends on how much and to what extent. So that's why getting the joints adjusted is so crucial to restore movement and health to the spine and pump that nutrients back into the disc, helping it to restore health. Now the problem we have is we don't see many discs like this. Quite often we see discs that are thinned and narrow, and the space for the nerve is less. So this is a disc that has lost some of its space, and this has lost even more. You're starting to get these bone spurs around because the body's trying to cement and secure the area and try and stabilise the spine, and the nerve, broad nerve, gets trapped in that space in through there. So swelling and inflammation, it's not always direct pressure, but swelling and inflammation will affect the nerve, and you most likely have pain all down your leg. But we sometimes see people with this kind of situation going on, and all they've got is back pain. Well, that tells us they've had a back problem for many, many years, because it takes many, many years to go from this to this, and eventually, if you're not careful, if you leave it too long, to this. You can see there's hardly any space left. The disc is almost completely gone. Lots of stenosis, so pinching and pressure on the nerve, poor mobility, not much movement in that spine, very stiff. So you see these people are really stiff and old and just can't move around very much. Now we can still help in that situation. Chiropractic and MBST, amazing for spinal stenosis, disc, joint problems in the spine, and especially if you've got pain down into your leg. So we can give you a couple of examples now. So in this spine we see this is a late 30s patient. You can see there's bones, fairly decent disc spaces, but when we come down to the last one you can see the much less disc space. The space where the nerve comes out is reduced. There's going to be pressure on this nerve in through here. You can see some of the osteophytes growing here. So that's bone spurs, because this disc is not providing the stability the spine needs. So the body's starting to try and stabilise itself by growing extra bone. And then there's lots of pressure onto the nerve in through here. Disc thinning and degeneration is just not limited to elder populations. Unfortunately, even in their late teens, like this chap here, you can see the space at this disc is less than this one. So that means this area has not been moving correctly for many years, even in a young adult. And the disc space at the base, you can see here, it's a nice big space coming through, less space here, pinching and irritation. This person didn't have any leg pain, they just had lower back pain, but it was pretty chronic and very acute. And it came on after doing some wrestling. So bouts of mild back pain, only made acute when they had an injury, but the injury just showed up an underlying issue with the discs and joints. This person now much better, fully back into training and fighting and doing really well. And on this x-ray is a female. You can see multiple levels of disc degeneration, not so severe at the base, but actually L4 almost completely lost, L3 is not great, L2, L1 here is not so bad, but you can see bone spurs, osteophytes growing through here, lots of disc space. This person is actually a fitness enthusiast, done lots of running events and gym goer, chronic back issues, seen lots of massage, physios, worked a lot on the muscles and releases and massage, but never had the spine checked and had adjustments, and you can see what happens underneath. If these joints and the spine's not moving correctly, you're going to get disc involvement, you're going to get damage to the disc, and you're going to most likely get symptoms and pain, inflammation, which causes back pain and can cause leg pain. This person actually did really well, had a course of MBST for her discs, with a huge improvement, great recovery, back doing sports, and doing much better again, and just looking to maintain, build some core strength around it. So you see, disc problems can affect us even if we don't have any idea what's going on. That's why the x-rays are so vital.